مرحبا مساء الخير أنا فادية الطويل بشكر
Welcome, ladies and gentlemen. Thank you, Mohammed bin Rashid Al Maktoum Foundation for Knowledge and UNDP. And today we will talk about the impact of COVID-19 pandemic on the health sector. We know UAE takes into consideration priority of the health people and citizens. It's a priority. Health first, and human beings is the center of our concern in the UAE. Today we will talk in particular about the impact of COVID-19 pandemic on the health sector. With us is Dr. Majd Naji, founder of Liberty Dental Clinic. Good evening, doctor. Today we are going to talk about the changes that took place after the pandemic. True. Let me introduce the audience about you more. Dr. Majd is a dentist, graduated in 1997, got diploma in dentistry from London. He established Liberty Group, and he is a consultant in Dental Ajman University. Dr. Majd, welcome. For 25 years, you have been working in dentistry. What was the first challenge during the pandemic? Good evening, Ms. Fadia. Thanks for Mohammed bin Rashid Al Maktoum Foundation for Knowledge and UNDP. Thank you very much indeed personally for the invitation. The first challenge that we encountered as doctors or dentists was knowledge challenge. Everyone, it was a new disease for us. Coronavirus is known, but the challenge that we encountered was that how to deal with this pandemic or this virus. And we noticed that during the first days of the pandemic, everybody was not sure how to know or to be familiarized with this treatment of this virus. Each country had its own protocol. Each university or hospital has its protocol. That was the first challenge, the challenge of knowledge. Therefore, the activity that we do now, which is Knowledge Summit in Dubai and UAE, which is the 7th edition, it is Knowledge Summit is a summit which started in the UAE. There was no pandemic 7 years ago, but there was a notice, a warning for the importance of knowledge. The first challenge was for all the doctors was the knowledge challenge. First, what is this virus responsible? Where did it come from? The best protocol for treatment of the virus. And we noticed that the severity of the pandemic became less and less. In the beginning, there was destruction in health. Systems of medicine were collapsing in the world. For even big advanced countries, I'm talking about Italy, USA, China, and other countries where there was a collapse in the medical system. Knowledge was very important at that time. Following that was the second phase, which is when the companies and governments, universities started looking for solutions to find a vaccine for vaccination in order to combat it. And then after that, to fight this virus, to disseminate and deliver the vaccine all over the world. We have confidence. We are now recovering towards the end of the pandemic. Most of the people in the globe have been vaccinated. Therefore, praise to Allah Almighty, we are in the era or phase of the recovery. So UAE has the leading role in taking and discovering the new cases and the vaccine. And the ranking of the UAE was number 8. UAE had quick response to the pandemic. Before the pandemic, we have the crisis management authority in Dubai and Abu Dhabi. There was preparation, there was preparedness, transparency, which is very important. I know personally that the numbers, we used to have accurate numbers of those who have the virus. The solution is to know awareness. Raising awareness is very important. And there was the lockdown in the right place. And opening or stopping the lockdown also was important for recovery. Technology was used, such as AI, artificial intelligence. UAE had the lead in this regard. Through AI, artificial intelligence played an important role in the control, and because the medical system was aware and the health department was aware. UAE was the first to start the vaccine and to manufacture it. Even now, you can notice that there is still the efforts continue in the UAE. Until last week, 300,000 testing. The main objective is to reach what we call community immunity. Doctor, in Liberty Clinic, you have a special experience which is successful with COVID. You were part of this campaign by the UN titled the Flexible or Agile Cities. With the beginning of the COVID-19 pandemic, the lockdown started. All clinics were locked down, and other specializations also were stopped. All locked down for non-emergency clinics. We were one of the establishments that had lockdown, but during that period, we prepared for the post-lockdown phase. Our management were divided into two parties. Even the clinic, it was divided into two. And we started to have an action plan through remote communication and internet with all the staff of the group, of Liberty Group. The action plan was based on 3 bases. If there are light cases or serious cases, so we have scenarios of how to deal with the cases, and depending on the severity, and how to deal with each scenario. And the doctors also were divided into two parties. One stayed at home, one group stayed at home, and the other were in the clinic. Similarly, the nurses and the staff and the admin. We were 2 parties. One were at the clinic, and the other party was at home. Till the first case of nurse had the virus. The first building was locked down. All people there were also stopped from work. They stayed at home.
and all the team contacting was tested, and the other team waited until another nurse was infected, and we remained until we have recovered completely and came back to the workplace. And all the workers in the clinics, either doctors and nurses, have a regular screening test on a weekly basis. All the staff is tested, and we have also an emergency plan if there is an infected person. Besides, other plans were activated through sanitization and raising awareness in the clinic, either by sanitizing the rooms or the equipment. Also, we have also time partners or partitions. Let's say that this system that we have created was published and explained through the platform launched by the UN immediately after the lockdown. We have many clinics benefited from the UAE experience, and the protocol of liberty was generalized over the many clinics. I think, Dr. Majd, that Corona has taught us to believe that we should think that Corona taught us that we have no ability to do anything. But there are many things affected, like education. But dentistry as a Liberty Clinic, how did you deal with that in a remote action with dentistry? How did you deal with that as a dentist? Remotely, of course. The UAE and Dubai particularly was a leading country and city in this connection by establishing medical consultation online. And we applied for the health authority in Dubai. There was time. How can a dentistry clinic can work remotely? I think Corona opened a lot our minds on things that we did not see before. In our clinic, we receive more than 57 patients from outside the UAE. Then the patient comes to the UAE and makes consultation to know the details. With cooperation with Dubai Health Authority, we have a department for consultation to sanitize dentists or teeth from a remote place. And we have many visible images by the mobile or special camera, and make X-ray. The patient can take it in any clinic by himself, then sent to the clinic under the control of the Dubai Health Authority by application, and consultation is provided to such patients who are outside the UAE. We have many applications, and the people were sitting in their houses, and there are many applications received by the patients. And once the airports were opened, this minimized. Of course, we followed up with them. And patients who could not visit us during the Corona pandemic, we communicated through the remote consultation and guide them what to do. And if they are in the UAE, we receive them during the lockdown lift. The age of the clinic is more than 24 years, and Corona pandemic drove us to think differently. This is the first international pandemic actually faced in our lives. You know, I personally learned a lot during the pandemic. We learned that everything we own is nothing before the health. We learned that we can work while we are at home. We learn a lot, really. But you, as a dentist, as you think, the effect was more on the patients or the doctors, as you believe? And what are the variables and the changes that took place on the patients or the staff or the doctors? If we would like to talk about that in details, we need a full lecture. The changes that happened on the medical sector happened on all segments. At the level of the countries, for example, many big countries, without mentioning names, collapsed actually during the corona pandemic. City mayors talked on TVs and unleashed that because they did not give attention to the importance of the medical sector. As you see, it affected all sectors like tourism, economy, education, and so on. Little part of the effect went to the medical sector. We see also many countries have allotted a budget for the medical research and health. Medical research currently has become a lot important in the budget of the countries. Many people suspected the vaccine. How did it appear and emerge during 1 year only? So the topic was concerning the ability, competence, and resources allotted for this. The studies and the budgets that allocated during the 10 years for producing one vaccine were made only during few months for the pandemic. I think there was a competition among the researchers of the vaccine during the pandemic. Many budgets and for many doctors were allocated for the medical research. Budgets were also allocated for that. The effort used to be spent in 10 years has been used during only 10 months. This is the change that happened at the level of the countries. Like the UAE, it has always been embracing many good things. And like, for example, giving the golden residency permit. And we saw that His Highness Sheikh Mohammed bin Zayed and His Highness Sheikh Mohammed bin Rashid made a lot of effort at the level of the country to afford this for the people. At the social level and patients, the awareness has risen more during the pandemic. If you notice that during a period, the importance of medicine in the community started to minimize. And as you saw on social media, people started to say, leave the stars or celebrities and go back to the doctors. I myself, as a doctor and a dentist, I respect my colleagues. We have seen a lot on the screens how doctors stayed for months and weeks, did not interfere and visit their families, and we saw many nurses lost their lives. The community, therefore, should respect and appreciate the medical staff. So the medical position has risen on the surface of the life and should be respected and appreciated. At the level of the doctors and the patients, we have felt we have started to feel with the responsibility that falls on our shoulders. Today, there was a coordination between the medical staff, but in the past, there was only one doctor maybe on duty. In every field or specialization, there should be at least 2 doctors. If one is affected, the other will replace him. So as doctors, we started to feel with more responsibility and more coordination. We started to see in the medical conferences, in all medical fields, as we see, there was a lecturer doctor in every international conference or summit anywhere. There is a participation by medical staff or cadre to be present and lecture. So they have a responsibility in this connection. Doctor, in your opinion, what the corona has affected most, or who the corona affected most, the youth or the old? I see many people change their lives, their lifestyles. As you think, who the coronavirus pandemic affected, which age segment? Actually, Ms. Fadia, it affected all. It affected, let me say that, it affected on the elderlies or the old age people. The First World War and the Second World War did not affect like the pandemic. I think the middle-aged people, which is the most segment from 30 to 50 years old, have been holding responsibility to protect their families and their parents and challenge the pandemic. So they had a big responsibility to combat and face the pandemic. The young and the babies have seen this pandemic for the first time. And I think it is the first crisis that this segment lives, but all the generations is scared from the unknown in the future. Because at the beginning, Fadia, of the pandemic, nobody knows or knew where we are going, what is the future. So this fear unified all the generations and the nations. This is, I think, one of the benefits and the advantages of the corona pandemic, because it unified and united the people and the countries and the societies. We should look at the coronavirus positively. We thought that the crisis tests people. Either it deals or treats people or kills them. Thanks God, we managed to eradicate and overcome and combat the pandemic. Complex medical life, we did not know in our stable life. We used to shake hands and kiss each other. We learned that we could not do that during the pandemic, and they became difficult habits during the pandemic. We did not realize that before, really, but we learned them during the pandemic. Actually, we used to carry diseases during these rituals and habits, but we did not realize them. But today, nobody, I think, likes to his father or his mother to catch a disease. I think when I get home, when I go to the bathroom and wash my hands and then shake hands with my father or my mother. Many things we used to do, like sitting in the seat of the plane, used to do, and used to catch diseases from them, but we did not realize them seriously. And through the pandemic, we learned from these things. I have a question, Dr. Fadi, sent by Muhammad, one of the audience. In your opinion, what are the protective procedures that international conferences and entities to avoid, to embrace in order to avoid the world from another pandemic? Another time, we should go back. This question shows us that we are qualified for another pandemic. It is not the topic of the international bodies or organizations or governments. It is the matter of individuals, actually. There are laws, but if we do not commit and comply by the laws, we will be affected by another pandemic. I'm not pessimistic, really, in this side, because travel has become very easy. So the matter is easier. Matter of travel has become easier. So the matter is, and the key and the trick is the person or the individual himself. The family should teach the individuals how to sanitize, how to keep safe, how to wash his hands. Because if we protect the family, we will eventually protect the society and the world, and not the reverse. The story is not the reverse. The topic is that many countries have put a lot of regulations and rules, and they are working on them until now. But there should be controls for the pandemic. For example, visiting the wedding halls and mosques has minimized people and participants, and we should, for example, wash our hands, sanitize our places and hands. I still, Mr. Majd, some people still refuse to take the vaccine. This is, Fadia, is a severe topic, and there was demonstrations and conflict in some countries. I personally, as a doctor, as a father also, and as a member of the society, I should say that your freedom ends when the others starts. So taking the vaccine, as I believe, a person and a doctor, is not a personal freedom. If you do not take the vaccine, you will catch the disease, of course, and you will carry it to the others. So the vaccine protects you and the others, and this reflects on the society's health in general. Many countries prevent the children who were not vaccinated before to contact others because they will communicate diseases to others and carry them to other people. So this is not a personal freedom, I think. Vaccines, myself and my family, my parents, everybody in my family has taken the vaccine, and I have an appointment for the booster vaccine also. I encourage everyone to take this vaccine. Every official and influential people, even the rulers also, have taken the vaccine themselves. Today, more than half the population globe know how they should live. Maybe one person has sensitivity or does not know the importance of the vaccine, because it is an immunization against corona and against other viruses and other diseases. So we should take the vaccine because this is severely important to protect us against the coronavirus and against the future pandemics, hoping that they will not come. there are a lot of things we have learned under corona pandemic. Dr. Majd, one more question. Is there, or is it possible to find a doctor, a dentist? Can we find in the near future a robotic dentist? I think, Ms. Fadia, is difficult because dentistry job does not depend on diagnosis. There are many medical sectors when depend on how the doctor asks you and diagnoses the disease. I am with this thing because we were the first clinics to enter the nurses, the robotic nurses. But in dentistry, the human touch and the human factor still has its importance. So the dentist works on his hands or by his hands. So this is very difficult, I think, for the robot dentist to do the same job. We have the ability to read the X-rays and the machinery or the technical personification, which cannot be done by the robotic dentist, by the way. So drilling and filling the teeth depends on the sense of the dentist himself. Some medical professions maybe other medical professions allow the other medical dentists, but in the dentistry it is not allowed. What are the best practices that have changed during the pandemic, and what are the most outstanding medical practices that changed, and how did you deal with them? The matter of sanitization in the medical field is important. The most successful operation, if it is not sanitized, it will be failure. So sanitization has become very important, severely important. For example, in every place, even in the waiting room. We have also the reservation and regulating the reservations. You cannot finish with a patient and see the other one before making the proper sanitization for the equipment and the hands and everything. And the air condition even. We started to replace almost everything in the medical room with the new systems that increase sanitization. All these procedures have become familiar, and we have become more aware about them. And the medical research also, all the medical institutions, Ms. Fadia, at the level of clinics or medical educational institutions or drug companies, there was a certain budget and certain researches for prevention. All these have become important and more attractive. We in Liberty Clinic are interested in training for the whole staff, and also the medical research is highly required by the research centers and the think tanks and universities as well. There is one more question. How the cases were followed, the cases that they need, for example, treatment while they are affected by corona. How did you follow these infected people with corona and they need their teeth to be filled? We in the dentistry have a protocol to deal with the communicable diseases. Like, for example, the hepatitis and the AIDS, treatment with these people, with these infected people, was very dangerous. So we use the protocol for dealing and treating these people. Let me say that the good side of the corona is that the incubation period of the virus was from 5 to 10 days only. So there is no necessity to deal with the virus case or the infected person with a virus. So one of the protocols is to use things, for example, certain protocols and following certain procedures, like, for example, wearing the masks and sanitization in the clinic and everywhere. There are ICUs also dealt with the corona infected people. But we say that the corona infected person in natural places is his infection lasts for only 5 to 10 days. So he can postpone the treatment of his teeth unless it is very severe. Did any cases, infected cases, come to the clinic, and did you receive any incidents in your clinic? Until now, 2 days ago, we have received a call from an infected person who called us and asked to postpone her appointment, and we thanked her for this initiative, really. So the practices of people have changed, and many calls are received from patients to cancel their appointments, and really we appreciate patients because they cancel their appointments because they have an infected person in their house or their home. Thanks God. On the other side, some patients called us that they had been in our clinic and they later discovered that they were infected. There was a certain protocol to deal with this patient to be isolated based on his test. And we again thank our colleagues in the medical cadres and staff. And we in Liberty Clinic, we have a laboratory that gives us the result of the testing during a few hours, 3 to 4 hours. With the development we have in the labs and the medical cadre, made our profession much easier.
Yes, you are a dentist, and at the same time, you have impact. People listen to you. When the pandemic started or broke out, there is the people thought that COVID-19 is transmitted by touch or by perfume or by air. As somebody who has impact and people listen to you, and as a role model, tell me about your role during the pandemic and the rumors, and about the vaccine. So some people say we don't want to take the vaccine. What was your reaction to these rumors? And what was your role as somebody who has impact? During the COVID-19, I was really, during the lockdown, I used to come out and as a doctor, as a dentist, or as a doctor, or as somebody who has impact, I was out in the media and to give advice. I didn't visit my parents or family, but I used to talk to the public as a role model. I gave the impression that I stayed at home. I didn't go out. We really participated, you and I, in many campaigns for the United Nations and for the United Arab Emirates to raise awareness and to commitment to stay at home during the pandemic and the sanitation of the campaigns. My role was that when I take a vaccine, I take it not that to show them, it's that I'm a doctor and I believe in it. If I suspect this, I took it, my wife took it, my parents took this vaccine. So whenever I take a vaccine, I put it on social media as a doctor and as somebody who has impact. This will be beneficial to the community. It's a responsibility of me as a doctor to raise awareness for my followers. You are a model, and we think you have a model family, your children. How do you deal? This is an open meeting. How can we teach parents and mothers to inculcate these values and concepts, how to protect our children? How did you deal with your children during the COVID-19? And how were you a role model? We said that this pandemic, we have to coexist with it. That was a pandemic, and we had to deal with it. First, my role was to stay at home, and my kids stayed 100 days at home. They didn't go out. There is no panic or fear at home. My relationship was closer with my kids and family at home. I used this pandemic to focus on the family values and to instill family values. And I showed them the importance of vaccination. My kids and children come with me to the clinic or to the mall. They clean and they sanitize without me telling them. They just follow the healthy style of cleanliness. It was part of their daily routine. This is an important issue. To avoid any coming pandemic, we need to take action as individuals and governments. We learned a lot, Doctor. We learned to greet each other by just saying hello without shaking hands or kissing. Another question, how was the staff of doctors managed during the pandemic? If one of the members of the doctors had this pandemic or this virus, how did you behave? We said this in the beginning. We separate those who have the virus. Anybody who is infected was isolated. Another question, is inflammation of teeth, if somebody has inflammation of teeth, can he stop taking the vaccine? For gum inflammation, there is no problem. But if there is an inflammation which is very severe with pain and temperature, then in this case, we wait to postpone the vaccine till the vaccination is finished, particularly if there is a swelling or temperature, or if there is fever. In vaccine, as a matter of fact, they check the temperature and the fever before giving the vaccine. Dr. Majd, we talked about the positive COVID-19 pandemic. We don't want to talk about the negative issues. We lived the negative aspect. Do you think we have overcome the pandemic? Is it over? I think the challenge first was the knowledge challenge. Now we know the pandemic, we know the treatment, we know the protocol of protection and treatment. The medical staff also are not worried or panicking about the pandemic. There are many diseases that kill 4 to 5 million people a year. But because we know the way we treat it, we weren't panicked. Knowledge, again, I reiterate, is very important. For the Knowledge Summit, and thanks to Mohammed bin Rashid Al Maktoum Foundation for Knowledge, knowledge is very important. Knowledge is the basic of science. It's the basic of life. Corona, if it comes back, we will not panic. We will not panic. We know how countries, families, communities deal with the COVID-19 pandemic. We had about many cases in the second case because we have the vaccine and the knowledge. When the second type of corona broke out, we had the knowledge, so we weren't panicking. We didn't panic. Everybody behaved and stayed at home. We knew how overcome the second pandemic. Praise be to Allah Almighty. Second issue is that corona will not end. In 1918, there was what we call flu, and there was no media or social media. We used to read about it in books. It killed millions of people then. Similarly, what we are living now, flu lived with people, outlived with them from 1918 till now. But knowledge minimized our fear. Today, corona will not end, but what will end is our fear. And the bullying of corona on us. Corona will not end. It will continue with us, but it will be like any other disease. Thanks to Almighty Allah, we live in a country, in the United Arab Emirates, that they are prepared for corona or any other pandemic. There's another question. Didn't doctors feel that science is unable to cure this pandemic? On the contrary, my friend, science, knowledge, scholars, doctors are the ones who rescued people. They weren't unable, they were able. We thank those scholars, doctors, those who provided vaccines, scholars in the field of immunology and vaccines. They worked in all fields in order to those who work in the field of transportation. Also, they were champions in the field of vaccines. Transferring of the vaccine and transporting of the vaccine was really an important issue. The scholar and the scientist who invented the vaccine is a champion. And the father who protected his children is a champion. The company owner is also a champion who protected his staff. I'm very proud as a doctor. I'm proud as a father, a doctor, a member of the community that we overcome this pandemic. the researchers are in a race for the vaccines. Knowledge and science played an important role in the recovery. We noted that lots of initiatives were launched. We in the United Arab Emirates, thanks to the state and to the wise leadership for the waterfalls initiative of the Ministry of Interior of the UAE for assigning 1 million doctors in the world through the internet. I was honored to be a doctor who participated in this initiative by the UAE. Lectures, medical lectures, courses for more than 1 million doctors and nurses all over the world. And they benefited from it, and they were given certificates of recognition and appreciation. Corona taught us a lot. We learned many lessons from Corona. Lots of initiatives that we never did before. We realized the importance of knowledge and science and initiatives.
Doctor, we have really a question. Will there be another booster fourth vaccine for the vaccine? I think some people have taken the fourth booster vaccine because according to the protocol, there is a kind of vaccine with a new protocol and a certain protocol, and some who took these kinds of protocols started to receive the fourth shot because the coronal vaccine has no difference from the flu vaccine, which has existed for tens of years. So the corona vaccine is the same like the flu vaccine in terms of the usage. The flu vaccine should not be taken every day, for example, but the flu vaccine. But if we go to another country or travel during the winter or something like that. So vaccine is a blessing from God, and we should use it and take it. Dr. Majd, what else do you advise? What final words do you have to tell us about the corona and the medicine? And the UAE was a leading country to overcome and beat the coronavirus. What would you like to tell us about your experiments that you have learned? We talked about the advantages of corona. The most important thing that we have learned from the corona is to be ready in all life aspects, not only in the medical field. Some people change their whole lifestyle due to the corona. They change their jobs because of corona. Some positions emerged because of corona. There are specializations emerged also due to corona. Corona taught us to be resilient and flexible, and these are one of the things that the UN described, the flexible and the resilient cities, because corona taught us to be so, and taught us to look for alternatives and look for solutions, and taught us also to be ready for anything else, either medical or social cadres, to be ready for the medical crisis, natural crisis, and any kind of crisis. Corona is not different from a tsunami. So we saw how those countries who faced tsunami have behaved in order to combat and challenge the tsunami. This experiment and education is global, to be ready and resilient to combat the coronavirus pandemic. we should be ready for any kind of a crisis, a health crisis, wars, or anything. I think Corona taught us to be ready, which is considered a positive shock for the or a trigger for the future. If we go back to the natural wars, natural crises, and the world wars like and TB also. Corona did not do anything, by the way, in comparison to these crises like the world wars or the natural crisis. I think this is the first international pandemic that happens under the internet and the social media. So we should thank God and praise God that we have existed under the existence of the communication and the technological advancement, because this advanced technology contributed and helped us. And once again, I am very proud of what the humanity and the international organizations and the UAE and we as doctors, we should be proud of all what we have done. We also thank you, Dr. Majd, because you had a vital role in combating the pandemic, either as a doctor or an influential. What is the final word that you would like to address it to the UAE? First of all, I would like to thank you once again, Sister Fadia, for hosting me. And I hope you will always be successful. I also would like to thank Mohammed bin Rashid Foundation for knowledge and for hosting me and inviting me. I would like to thank all the participants, every lecture also in the Knowledge Summit in all fields. And the final word that I would like to tell the people with us today: knowledge is the base of every successful thing, and the base of every science, and the base of combating and facing any danger or any risk. So knowledge is so important. I hope as the UAE and Dubai have accustomed us that this knowledge will be transferred and disseminated in all fields and globally in all fields and in all sectors, not only in the medical sector. Without knowledge, I think the pandemic would not have been beaten. I think knowledge is the base of everything. We really, again, thank you for this session. You are always a model and a good example for every good thing, Dr. Majd. You are a good example for the most. I would like also to thank Mohammed bin Rashid Foundation for Knowledge and the UNDP, and I would like to thank you all the audience for their attendance and presence for enriching our minds. As you said, Dr. Majd, knowledge is very important. I would like to thank you again, and MB Mohammed bin Rashid Foundation, hoping that we will meet you in other enriching meetings. Thank you for this participation. Have a good night. Bye-bye.